All right, so today we're here at Lift Plastic Surgery. We're talking about brow lifts versus eyelid surgery, right? And so Meredith has some questions about, hey, how do we decide between these two things? Because they're commonly done. Any thoughts on any of this?
Tell me what I need.
Oh my God! All right,
What's the difference?
This is the number one way plastic surgeons die today in America. Just kidding, right?
Yeah, be nice.
In terms of these things, this is just completely objective things that we're talking about to say, hey, when does one matter more than the other? Is there a right sequence to do these things in terms of whether it is a brow that we're trying to affect or an eyelid that we see in photos or in the mirror or things like that? Most commonly, we see patients that say, hey, I don't like the way this looks in a photo because they see somebody captured it, it's like half blank or, that they've been under the influence or something like that, where things might change a little bit in terms of lighting and how they are seeing themselves in photos. So, what happens to the brows and the eyelids? So when I'm looking at Meredith is young, takes good care of her skin and does all the right things, right, for herself. And so if she's saying, hey, well, I feel like I'm looking more tired from my upper eyelids, what exactly is that? So when we're looking at the upper eyelids and the brow, we're looking at the top third of the face. And usually faces, we split them up into thirds. So top third, middle third, and lower third. So today we're just going to talk about top third things to say, hey, what are the things that change as we either get older or we have injury, things that we might be born with, different ways that, things can present themselves with how we look in that area. Questions so far?
So far, so good.
Okay, so I'm not dead yet. So in terms of brows, so if you look straight forward for me, right now what I'm looking at to say is there a peak? Where is this peak? And in terms of the brow, I'm looking to say, hey, is there a peak in that lateral brow that lifts it up to give it that kind of arch shape? Now, everybody has different preference in terms of what that arch looks like, right? So Taylor back there, she's making faces. She's got a different brow shape. She has a different arch shape, but she likes it a certain way. And everyone likes it a different way. You can actually even see this arch shape in terms of brows with our parents. So it's one of those things to say, okay, well, do I have my dad's brows, my mom's brows, or how does this all look, right? Women generally get the same kind of eyebrows as their mothers in terms of the shape. Now, can you do anything to adjust it? Well, there's so many different things, right? We've seen people that come in with tattooed eyebrows on, right? We've got different, hair transplants for different eyebrows if something's happening about that. But in terms of the brow itself, what happens over time? Over time, some of the volume that is underneath the brow changes. And that can be the bony volume or the actual muscle or the fat that's there. Now, when that changes, then the brow is actually supposed to be above the bone. Especially in women, it's supposed to be above the bone. And for men, it's supposed to be right at the bone. Anything below that is saying that the brow has kind of come down, right? Gravity has pulled it down, or our lives have beat it down in terms of use or volume that has gone away. So when we look at the brow itself here, and I'm actually feeling for her bone is right there, right? And so her medial brow dips a little bit below the bone, her lateral brow is above the bone, which means that it's in a good shape and a good position. Now, if she looks like this, she's going to look surprised all the time. So that's also something that we also want to take care of, and especially when we're doing Botox or things like that in terms of neuromodulators. Those neuromodulators can do a lot of different things to the brow. One, they can drop the brow, especially if you're only treating the frontalis muscle, that's the top muscle up here that creates the wrinkles, or it can also raise the corner of the brow if you put it in the right place. Questions about any of the brow parts so far?
So far, so good.
Am I still alive?
You're doing good so far.
Okay, all right. So in terms of the brow itself, we can actually measure these things. And that's the whole thing to say we want to look at each of the components. So if I look at how wide her brow is, we're looking at about 6 centimeters. So in terms of 6 centimeters, if you split this up into fifths, we want to talk about the lateral fifth. And so that's like, about 1.2 in terms of centimeters right there. And this is the lateral fifth of her brow here. So if I raise this here, she kind of has a more natural shape to it. Now, if I come more medial, then you're getting into the shape of a more manly looking brow, right? So it's different in terms of men and women, in terms of the shape and where things land. So we talked about it being above or at the bone. So above the bone for women, more lateral raise for women in terms of the brow shape, more of a natural arch for the brow itself versus a half semi kind of colon or semicircle, right, for men for that position. That's how we assess the brow, to say, okay, where does it sit? What does that volume look like? Are there things that we can do to adjust it with or without surgery? Some of the non-surgical options are in terms of adding volume underneath there, or things that we can do in terms of surgical options of lifting the brow. Now, in terms of the brow is the first thing that we want to look at when somebody's talking about the top third, because that's one of the main factors. Now, also, when's the last time they had Botox? That's another consideration to make, because their brow might be in a different position now because they've had Botox. Because if they've only done the front house, the brow's going to drop an average of 1 millimeter. When it drops 1 millimeter, up here it doesn't sound like that much, right? But literally, if you look at her upper eyelid there, and I push down on this, you're going to see more of a hood to her upper eyelid. Now, when you look in the mirror, you say, well, I need an upper eyelid surgery. Well, the real problem is actually the brow position. And that happened because of Botox. So this scenario, right, we don't have any of that playing any roles in terms of where the brow position is. So we're talking about, hey, can we lift it? And if we lift it, does that extra skin of the upper eyelid go away? So close your eyes for me. So if I lift her brow and I put it in this position, and we're lifting it a good about 5 millimeters or so. And so when I'm looking at the position I'm lifting at 5 millimeters, I don't see any extra skin for her upper eyelid. And that tells me, hey, she's probably going to be great if the upper eyelid bothers her just from a brow lift. Versus if you have extra skin for the upper eyelid, then we're talking about also doing a brow lift with a little pinch for her upper lid. Now, in terms of if it doesn't resolve with the brow, or the brow is in the right position, then you want to say, hey, what else could it be? And what else could it be is it the upper eyelid itself? And again, you're checking reflexes from the eye, you're checking the pupillary light reflexes from it, and also seeing if there is a snapback, right? How much skin when you pinch it, how long does it take to retract in terms of the upper eyelid? Question so far?
Just how does the procedure actually work? How do you do it? How do you lift my brow?
All right, get to the point.
Tell me what we're doing this afternoon. Like, walk me through the process.
She's already in. Right. And so in terms of when we do the markings for somebody when we're doing a brow lift, again, I'm looking at about that 1 centimeter, 1.2 centimeter from the lateral edge here. That's where I'm actually saying, hey, that's the point of optimal marcation. So right about here. And so what I'm doing is I'm looking up to say, hey, how can I do this up hidden in the hairline so no one's going to see any of this incision? Usually in the scenarios we're doing this, we're making either 2 or 3 incisions. Sometimes we have to make 5 depending on if we want more of a lateral pull, and that's usually in more elderly patients that we're also changing that lateral shape of that brow. Without having to do that lateral incision, then you're literally just going up from that 1.2 to 1.5 centimeter to say this is the angle that we're pulling this brow up, and that's where I want everything to be anchored. So that's where I'm going to make my incision up in this little hairline here, about 1 centimeter back, and that's where we're going to hide it for a couple centimeters in terms of the incision to get access to lifting that tissue up, releasing that medial brow, making sure the nerves are all good, and then releasing the lateral brow as well so that it all raises up about that 5 millimeters in kind of shape to get it to where she would want it to be.
Okay, we do have a quick question.
Okay.
So does this mean all of the incisions are invisible, or will she have scars?
Yeah, and so when we're doing an endoscopic brow lift, they are all invisible because they're all hidden in the hair. And so the ones that we make here, the one up here, if we have to make one in the middle, I try to avoid where she parts, because if she normally parts in that area, I don't want this incision to be seen. So I'll be a couple millimeters right or to the left, depending on where that part happens in her face. And then the other part is the other side as well, and marking that area. When I'm marking these areas, I'm also looking to see, hey, where does that temporal muscle also attach to the top of the skull and the bone? And so if you bite down for me, and you can see right here is kind of the actual angle for her that this temporal muscle gets attached here. This is that conjoint tendon. It's that fusion point between where that muscle attaches that also elevates part of the jaw and where this plane is to lift the brow. Okay, I need to release that to actually get adequate release of it, and then we're actually anchoring it back up into kind of the areas of the skull. We use different devices for this, and so for one thing that we can use commonly is this endotine device. It's we make a little tiny hole in the bone, and we put this endotine device that holds that skin up, but this is all absorbable, so it goes away in a short period of time. And so in terms of these endotine devices, they look like this here. And so they pretty much go down. You can barely feel them underneath the skin because we use the ultras. These are the least projecting ones. And then you're just holding that tissue up there while it scars in. And when it scars in, the device is absorbable, all that goes away, the incisions are hidden in those places, and the brow is set in its position, its new position.
Okay, we do have another question.
Okay.
So that plastic thing goes into the bone?
Yeah. And so that plastic thing goes into the bone. So it means that we have to make a little spot for it. So we make a little tiny little hole that fills in over time, right? That bone kind of regrows in that area, and we're putting that in to hang that tissue back up into position to hold it in place while all the tissue scars in.
How deep do you have to make the hole?
Yeah, so the hole is usually only about 4 millimeters, right? And so it's not that deep in terms of it. And again, the bone is pretty thick in that area, so you're not getting into anything dangerous.
How long is this going to take when we do this later this afternoon?
So the whole procedure itself takes about an hour and a half to 2 hours or so, just depending on what we're addressing at the same time. So if we're doing more incisions or we're having to also pull that lateral brow or anything like that, like this way, then, it can take a little extra time in terms of half hour to then also make that incision about a centimeter back behind this hairline. That's protected from where the nerve, that frontal nerve actually runs that picks up the frontalis muscle. And it also protects it from the superficial temporal artery, superficial branch that comes across right there more posteriorly. And so that's kind of the areas that we're looking for in terms of releasing. And then when we release all this tissue, we're also avoiding some of the veins, right? So you've probably seen some of these veins when you're doing Botox, and they're right out here, and these are called like the sentinel veins. And they all kind of come into a bigger vein that's in there. And that's what we try to avoid so we can have less bruising.
Awesome. What should I expect as far as the healing process afterwards?
Yeah, the healing process is pretty quick. The only thing that comes down to is how do we bruise, right? Because mainly when we're releasing this, we do the surgery up here, but where do the bruises show up? They show up here, underneath the eyes, right? And so in terms of the gravity pulling that down, pulling it through the different membranes and the fascial layers, then you can get a little bruising there. That bruising usually lasts about a week to 2 weeks or so. And then this all heals pretty quickly, right? So in terms of the incisions themselves, we're taking out any sutures or staples usually at about 1 to 2 weeks. And other than that, there's no drains or anything like that that's in place.
How long? So just the incisions would only be in my hairline. How long do I have to wait to wash my hair after?
Yeah, so usually we tell you to wait about 5 days or so to wash your hair, because I don't want you pulling on the incisions or anything like that. You can get them wet about 48 hours after. You can run water through there, but we don't really want any of the rubbing on any of the incisions because we want everything to heal perfectly.
All right.
Yeah.
Awesome.
And then one of the most other common questions that we ask is like, hey, I'm going to have a bald spot, right? Do you need to shave my hair where you're getting these incisions? And no, we don't need to shave your hair. We try to avoid all the hair follicles so you're not having any patchy hair loss or anything like that for each one of the incisions that we do. Again, we've been able to do it with just 2 incisions, or we do it with 3, or we do it with 5, depending on what we have to achieve in terms of shape of the brow and where we're trying to put it. And that's how we do the brow look part. Now, the upper eyelid, depending on if the brow is already in the right position, then that's a little bit different in terms of saying, hey, close your eye for me for a second, and saying, hey, how much extra skin do we have in the upper eyelid? And that's where we're doing a pinch test, and we're also looking at light reflexes to say, how much skin is too much to take? And then we're actually drawing out that shape, essentially, that comes across. That would be, from the medial part here, we're trying to stay right at that tarsal plate level, and that comes out here, right there. And again, we would mark all these things with calipers, right, to get it to the right position, but she doesn't really have much extra skin here at all. This is just saying, hey, somebody erroneously did the wrong thing first, which means that they said, okay, well, she needs an upper eyelid surgery. Well, if they did an upper eyelid surgery and took the skin, when they did their brow lift later, she wouldn't have enough skin to raise. And that's where you can have complications or problems. So if you're doing anything with your upper eyelid, top third, or anything like that, always do the brow lift first.
So when you say that, you mean I wouldn't have enough skin to close my eyes all the way?
Mm-hmm. Which would mean that you would get dry eyes, you can have ulcerations, more complications in terms of, being able to see, things that we don't want to interrupt or affect at all. So that's why I'd say when you do an evaluation for the top third, always look at the brow first. That's number 1, number 2, number 3, then go to the upper eyelid and then figure out if there's anything else going on, right? Let's say one side droops a little bit versus the other? Well, is there any ptosis? Is there any muscle weakness? Other things that we might need to do to address those things at the same time.
Awesome. Any other questions?
We do have some questions.
All right.
So how do I know if I need a brow lift surgically or if I just need some Botox?
Right, and so I think it's one of those things that you can try before you buy, right? And so you can see how you like Botox for that area if it gives you enough of a lift. Now, in terms of who you go to as an injector, it's super important they're trained in the anatomy of where to inject to get that brow lift to actually happen in the right place. Versus, I've seen this common mistake of people putting it here and say, I'm going to do a brow lift, and they put it here, and then they put it also a drop here. So essentially, anything they've done to lift, they've then defeated it by dropping it as well. So that's one of the things that you want to pay attention to when you're trying to do a brow lift for the lateral brow, in terms of injecting in those places to get this part to lift up and get this part elevated. In terms of the medial brow, the biggest way that we raise the medial brow is injecting the depressors of the brow. And this is the corrugator right there, right? And when we inject those, it's injecting them with enough Botox to get the elevation of this. This is the other part that combats when we put Botox in the frontalis muscle. So this drops at about 1 millimeter, this picks it up 1 millimeter, so they end up being at the same spot. So you don't see much changes for the brow. Well, if you want just a brow lift and you don't have many wrinkles up here like Meredith, then you could just do here to lift up the brow and then also lift up the lateral brow, and that will give you a natural brow lift. Now, if you like that result, then that's something that can easily be done surgically.
Awesome. We have a really great question. If I get a brow lift, will that help with crow's feet?
That's a good question, right? And so in terms of crow's feet here, when you lift up the brow, you can see this whole area gets smoothed out. Now, depending on how much you lift this up versus actually pulling this out, you can address crow's feet and that lateral brow all at the same time. So I think if it's on the list of concerns, that's where you'll end up with that extra little incision that will be in the hairline here, but it will pull everything in this way to make it nice and tight.
Another question. I have had threads before. Would I still be a candidate?
Yeah, so threads can cause some scarring in different areas, right? And so it really depends on how many threads you've had, how long you've had them, what type you've had, and are they permanent or absorbable, and then where's the location for those threads. You can still be a candidate for them because the layers that we're actually going is deeper than where the threads are normally put in. The threads are a little bit more superficial for these areas. So it would be a deeper plane that we'd be able to do the brow lift, and you'd have more of a long-term result.
What layer, like where do you attach the endotines for the brow lift?
Yeah, so the endotines itself are going right onto bone, right? Versus when you're doing threads, they're all in the subcutaneous tissue, which is not that thick. So as long as they're staying above the bone and the periosteum, there's that little layer that's on top of the bone, then that's in a safe place for the threads. Again, kind of cautiously, because that's where also the nerves can run as well in terms of the vessels. Versus that deep periosteal plane, there really aren't any other vessels there.
What is the most common age that people come in requesting a brow lift?
Yeah, so it can start as early as in the 30s, right, and go all the way to the 80s in terms of whether you need a brow lift or not. There's different ways to do these brow lifts. You can see the history of them in terms of it being endoscopic is usually the mainstay right now. They have coronal ones where they made incisions in the hair itself to then lift up the entire scalp. They have different ones in terms of endoscopic ones, and then direct incisions, right, in terms of a wrinkle that was here or right at the edge of the brow as well. Again, these don't leave the best scars for those direct brow lifts. It's still an option in the patients that can't undergo anesthesia or can't tolerate any other type of procedure.
Is this considered permanent or is it something that would fade over time?
So it depends on when you do it. Is say like if somebody did this in their 80s, it's pretty much permanent for them, right? In terms of their youth, it really depends on anything. If it changes for, oh look, we have a visitor, right?
I know.
Hi,
I
how's it
know,
going?
Joe.
You want to learn about brow lifts too?
Yes, I do.
You're welcome to. All right. And so in terms of the part about the brow itself, usually the results are pretty long in terms of this. They can last about 10 years or so, and it depends on what changes or what are we doing in terms of maintenance. There's all these things that are now available in terms of non-invasive radiofrequency microneedling, Also adding volume at the same time you do a brow lift in terms of replacing like with like in terms of what's missing. Is it bone that's been resorbed? Is it sculptura that also adds in volume to the temples that also ends up lifting the brow? Is there fat that we can inject in terms of that area? So there's a bunch of different things now that can help those results last long.
Another question. What is the most common concern or question that people have in their consultation?
I think the biggest concern they have is like, hey, what is the downtime for this? I think the downtime is the biggest question because like I gotta get back to work. This is on my face. Am I gonna be all bruised or puffy? Usually you're not puffy or anything like that. It's mainly the bruises around the under eyes are the biggest ones that people have questions about.
That leads us into our next question, actually, which is how soon after I get the surgery will I be able to notice my final results?
Well, the results are pretty quick because, again, when we're putting this in the right place or putting the end-of-time unit, essentially it's seating that result right there. So in about 6 weeks, you'll know where that permanent brow height is because everything is scored in.
Awesome. What are the signs of a poorly done brow lift?
Ooh, a poorly done brow lift, that's a good question, right? In terms of that, it's the same assessment to say, hey, is the brow at the level of the bone or is it below, right? If it's in a female, it's done and it's below, then it was poorly done. If the medial part was not released enough to elevate it, that's also something that was not done appropriately because, again, that volume might not have been there. So it comes down to whether they need to be lifted or there needs to be put volume in terms of the assessment. It comes down to the assessment of what are we starting with and where do we end up and how much time has gone between or evaluation of what was done.
Awesome. Another question we have is how do you make sure both of my brows are even?
So it comes down to the assessment for the initial part. So when I look at Meredith here and I actually drop this across, she's pretty darn even in terms of her brow, right? I think one side of her brow, she could move stronger than the other, right? And because you can see this peak here is a little bit higher than this peak here. Now, knowing that, it's a discussion to say, hey, even though I put these brows in the right place, when she's not moving, that muscle in terms of that side is just going to be stronger. So it might pull a bit more when she looks concerned or when her kids are doing something they shouldn't be or whatever, right? In terms of that part. But I think that's the whole thing. And then knowing how many millimeters I'm going to move on each side. You can do these things differently on each side to make them level. Even from last week, we had a patient that had one side lower than the other. We were able to release and then move it much more on one side. Make sure the release was even more greater on one side versus the other side.
Awesome. Are there any other treatments that you recommend to pair with the brow lift?
Yeah, and so sometimes the brow lift can be done with upper eyelid if you're doing a little pinch or anything like that. Sometimes we also recommend lower eyelid if you're doing a lower eyelid bleph or CO2 or skin resurfacing. Anything that helps match the thirds all blend, right? So if you're doing top third, then you want to think about all things in the top third, anything that blends into the middle third. And that's how I look at saying, how do we pair things together for a certain area? Because then that gives you a consistent result versus something looking, just in the middle third change, but we don't change anything to the top or the bottom.
Awesome. Gabby was wondering if a brow lift can help with her vision.
Yeah, and so it really depends if you're having visual fields that are not being able to be seen. You can get a visual field test done at your optometrist, and that kind of comes down to they tape your eye open, and then they look at the visual field and say, hey, can you see more or not at all the extremities? Now, if you can, sometimes it's due to the brow. A lot of times it's due to the upper eyelid when it's gotten that bad, or it's a combination of both.
Awesome. How do you help people prepare mentally and emotionally for this kind of procedure?
Yeah, it's a great question, right? In terms of preparation, I think most people have thought about this for a long enough period of time where they actually, want to make this change. Because it takes a lot of emotion and courage to actually step into a plastic surgery practice or an office to say, hey, I want to have this adjusted or changed. So they've been thinking about it a while. Now, in terms of the mindset, the whole thing is making sure it's safe and secure for exactly what they want.
sorry.
Yeah.
I didn't know y'all were recording.
No,
It's
no,
okay.
I'm giving you this back.
awesome. Thank you.
Thank y'all so much.
No problem. Have a good one.
You too.